Most people know their blood pressure, many know their cholesterol, but there's another number, quiet, invisible, and often ignored, that may be telling a far more important story about your future health. A number that can quietly predict heart disease, kidney failure, nerve damage, stroke, dementia, even certain cancers years before symptoms appear. That number is your HbA1c. And what makes HbA1c particularly dangerous is that it rises silently. You can feel perfectly normal while your biology slowly shifts in the wrong direction. No pain, no obvious warning signs, just subtle metabolic damage accumulating day after day. During years working in emergency medicine, one pattern appeared again and again. People rarely arrived at the hospital suddenly developing metabolic disease. Instead, they arrived with the consequences of something that had been developing quietly for years, sometimes decades. A man in his early 50s with his first heart attack, a woman with kidney damage that seemed to appear out of nowhere, a patient with a wound that refused to heal. When we checked their records, the same signal often appeared long before the crisis. Their HbA1c had been creeping upward for years. HbA1c stands for glycated hemoglobin. Hemoglobin is the protein inside your red blood cells that carries oxygen through your body. When glucose blood sugar is circulating in your bloodstream, a portion of it attaches to hemoglobin. The higher your blood sugar levels over time, the more hemoglobin becomes coated with glucose. Your HbA1c test measures what percentage of those hemoglobin molecules have sugar attached to them. Because red blood cells live for roughly 3 months, HbA1c becomes a rolling 3-month average of your blood glucose levels. It's one of the most reliable indicators doctors have for understanding long-term metabolic health. In many countries, a normal HbA1c sits below about 5-7%. Between 5-7 and 6-4% is considered prediabetes. At 6-5% and above, the diagnosis typically shifts into type 2 diabetes. But here's the crucial detail most people don't realize. Damage often begins long before those official thresholds. Even modest increases in HbA1c are associated with rising risks of cardiovascular disease, nerve damage, and cognitive decline. It's less like a switch turning on and more like a slow dimmer gradually increasing the stress placed on your cells. The encouraging part of this story is that HbA1c is remarkably responsive to lifestyle changes. Because it reflects how your body handles glucose day after day, small consistent adjustments can shift the trajectory of your metabolic health in powerful ways. What follows are 15 scientifically supported strategies that improve insulin sensitivity, reduce chronic glucose exposure, and help bring HbA1c levels back toward a healthier range. The first one is also the most obvious, and perhaps the most powerful. Reducing refined carbohydrates and added sugars. Refined carbohydrates such as white bread, pastries, sugary cereals, and sweetened beverages are rapidly broken down into glucose. Within minutes of eating them, blood sugar levels can spike sharply. These repeated spikes place enormous strain on your insulin system. Over time, the body begins to struggle to keep up. Cells become less responsive to insulin, blood sugar remains elevated longer after meals, and HbA1c slowly climbs. Liquid sugar is particularly problematic. Sugary drinks move through the stomach quickly, bypassing many of the normal signals that slow digestion. The glucose surge can be faster and higher than when the same calories are eaten as solid food. Replacing refined carbohydrates with slower digesting foods such as whole grains, legumes, vegetables, and intact fruits can dramatically flatten these spikes. It's not about eliminating carbohydrates entirely. It's about choosing the forms that your metabolism can handle without being overwhelmed. The next strategy builds directly on this idea. Increasing dietary fiber. Fiber changes the way food moves through your digestive system. Soluble fiber absorbs water and forms a gel-like substance in the gut, slowing the absorption of glucose into the bloodstream. Instead of a sudden spike, blood sugar rises more gradually. This slower release reduces stress on the insulin system and improves overall glucose control. But fiber is doing something else at the same time. It feeds the trillions of bacteria that live in your gut, your microbiome. And emerging research suggests that the composition of these microbial communities plays a direct role in insulin sensitivity and metabolic health. People who consume higher fiber diets tend to have more diverse gut microbiomes and better blood sugar regulation. Most adults, however, are eating far less fiber than recommended. Aiming for somewhere between 30 and 40 grams per day from foods like vegetables, beans, lentils, nuts, seeds, and whole grains can dramatically shift the metabolic environment inside your body. The third strategy is one that is surprisingly overlooked in discussions about blood sugar. Protein. Protein has a powerful influence on how your body processes carbohydrates. When protein is included in a meal, it slows the rate at which food leaves the stomach. That slower gastric emptying delays the entry of glucose into the bloodstream, producing smaller and more manageable blood sugar rises after eating. Protein also stimulates the release of insulin in a controlled and balanced way, helping guide glucose into cells where it can be used for energy rather than lingering in the bloodstream. There is another interesting effect as well: satiety. Meals higher in protein tend to leave people feeling fuller for longer periods of time. That fullness naturally reduces overall calorie intake without the sense of deprivation that often accompanies restrictive diets. Researchers studying metabolic health have also noticed something intriguing about breakfast. In several clinical trials, individuals who consumed a higher protein breakfast experienced smaller glucose fluctuations throughout the entire day compared to those who began the day with carbohydrate-heavy meals like toast, pastries, or sugary cereals. In other words, the first meal of the day can set the metabolic tone for the hours that follow. Eggs, Greek yogurt, fish, poultry, legumes, and tofu are all excellent sources of protein that support stable glucose control. Another dietary approach that has consistently demonstrated benefits for HbA1c is the Mediterranean diet. This pattern of eating has been studied extensively in large clinical trials. One of the most well-known is the PRIDIME study, which followed thousands of participants over several years. People who followed a Mediterranean dietary pattern rich in vegetables, legumes, fish, olive oil, nuts, and minimally processed foods experienced significant improvements in cardiovascular and metabolic health. What makes this approach particularly effective is not one single ingredient but the overall combination of foods. The diet is naturally high in fiber, healthy fats, and micronutrients while being low in ultra-processed products that tend to drive glucose instability. Interestingly, many participants in these studies improved their blood sugar control even without aggressively restricting calories. The quality of the food itself was doing much of the work. Weight management is another factor that strongly influences HbA1c, particularly when excess weight accumulates around the abdomen. Fat stored deep within the abdominal cavity, known as visceral fat, is metabolically active tissue. Unlike the fat just beneath the skin, visceral fat releases inflammatory molecules and hormones that interfere with insulin signaling. It also promotes fat accumulation in the liver, a condition known as fatty liver disease, which further disrupts normal glucose metabolism. Research consistently shows that even modest weight loss, around 5 to 10% of body weight, can produce meaningful improvements in HbA1c levels. In one well-known clinical trial examining diabetes remission, nearly half of participants were able to bring their disease into remission through sustained dietary weight loss. The goal isn't extreme or rapid weight loss. Crash dieting often leads to short-term changes followed by regain. The goal is gradual, sustainable fat loss, particularly the reduction of visceral fat surrounding vital organs. While diet plays a central role in glucose control, movement is equally important. One of the most powerful tools for lowering HbA1c is resistance training. Skeletal muscle acts as one of the body's primary storage sites for glucose. When muscles contract during strength training, whether lifting weights, performing bodyweight exercises, or using resistance bands, they draw glucose out of the bloodstream. This happens through a pathway that does not rely entirely on insulin. Special proteins known as GLUT4 transporters move to the surface of muscle cells during contraction, allowing glucose to enter the cells where it can be burned for energy or stored as glycogen. Over time, increasing muscle mass effectively expands the body's capacity to handle glucose. Multiple clinical trials have demonstrated that resistance training can significantly reduce HbA1c levels even in the absence of weight loss. 2 to 4 sessions per week are often enough to begin producing measurable metabolic benefits. But muscle is only part of the movement story. Aerobic exercise also plays a crucial role. Aerobic exercise improves the body's ability to use oxygen and produce energy efficiently. Activities such as brisk walking, cycling, swimming, or jogging stimulate changes deep within your cells. One of the most important changes occurs inside structures called mitochondria, the energy-producing engines within your cells. Regular aerobic activity increases mitochondrial density and efficiency, allowing cells to burn glucose more effectively. Exercise also improves insulin receptor sensitivity. In simple terms, your cells become better at responding when insulin signals that glucose should move out of the bloodstream. Over time, these adaptations translate into lower average blood glucose levels and a reduction in HbA1c. Interestingly, the relationship between aerobic exercise and blood sugar control isn't about extreme intensity. Consistency matters far more than occasional bursts of effort. A 30-minute brisk walk every day often produces greater metabolic benefits than a single intense workout once a week followed by long periods of inactivity. And there is one simple habit that appears especially powerful: walking after meals. Research examining post-meal activity has found that even a short 10-minute walk following a meal can significantly reduce the spike in blood glucose that normally occurs during digestion. Muscle contractions during that walk help shuttle glucose into cells before it has time to accumulate in the bloodstream. For people trying to lower HbA1c, this small habit can become a surprisingly effective metabolic tool. But structured exercise isn't the only movement that matters. There is another category of physical activity that scientists call NEAT, non-exercise activity thermogenesis. This includes all the movement you perform outside of formal workouts: standing, walking around the house, climbing stairs, carrying groceries, even small movements throughout the day. What researchers have discovered is that prolonged sitting can negatively affect glucose control even in people who exercise regularly. Someone might spend an hour at the gym each morning but then sit at a desk, drive home, and spend the evening on the couch. In metabolic terms, that person may still be considered largely sedentary. Breaking up long periods of sitting with short bursts of movement, standing, stretching, walking for a few minutes, can significantly improve blood sugar stability. In many cases, the difference between two people with similar diets and exercise routines comes down to this subtle factor: one moves constantly throughout the day, the other remains seated for hours at a time. Their HbA1c levels often tell the story. Another factor that profoundly affects glucose metabolism is sleep. Sleep deprivation alters the delicate hormonal balance that regulates blood sugar. When sleep becomes chronically restricted, cortisol levels rise, insulin sensitivity decreases, and fasting glucose levels begin to climb. One well-known experiment placed healthy young adults on a restricted sleep schedule, just 4 hours of sleep per night, for several consecutive days. By the end of that short period, their insulin sensitivity had dropped to levels resembling early type 2 diabetes. It's a remarkable illustration of how quickly the body's metabolic systems respond to sleep loss. Consistently getting 7 to 8 hours of high-quality sleep helps stabilize hormonal rhythms, reduce cortisol, and improve the body's ability to manage glucose. Alcohol consumption is another factor worth examining honestly. When alcohol enters the bloodstream, the liver shifts its attention toward breaking down that alcohol. During this process, other metabolic tasks, such as regulating blood sugar, temporarily take a back seat. Frequent alcohol intake can contribute to increased liver fat, impaired insulin signaling, and elevated triglycerides, all of which influence HbA1c levels. Occasional moderate consumption may not have dramatic effects for everyone, but regular drinking, particularly daily alcohol intake, can quietly push metabolic markers in the wrong direction. There is another piece of the puzzle that often receives far less attention than it deserves: visceral fat. Visceral fat sits deep within the abdominal cavity, wrapped around organs like the liver, pancreas, and intestines. Unlike the fat you can pinch beneath your skin, visceral fat behaves almost like an endocrine organ. It releases inflammatory molecules and hormones that interfere directly with insulin signaling. The more visceral fat accumulates, the harder it becomes for insulin to perform its job efficiently. One particularly concerning effect occurs in the liver. Excess visceral fat often leads to fat accumulation within liver cells, a condition known as non-alcoholic fatty liver disease. The liver plays a central role in glucose regulation. It stores glycogen, releases glucose between meals, and responds to hormonal signals that maintain blood sugar balance. When the liver becomes infiltrated with fat, those processes begin to malfunction. The liver may release glucose into the bloodstream even when levels are already high. Over time, this contributes to persistently elevated blood sugar and rising HbA1c levels. The encouraging part is that visceral fat tends to respond relatively quickly when overall metabolic health improves, as insulin sensitivity increases through better diet, exercise, and weight management. Visceral fat often decreases more rapidly than other fat stores. Another factor that strongly influences blood sugar but is often underestimated is chronic stress. Stress is not only a psychological experience, it triggers a cascade of biochemical reactions throughout the body. When the brain perceives a threat, the adrenal glands release stress hormones such as cortisol and adrenaline. These hormones evolve to prepare the body for immediate action by increasing available energy. One of the ways they accomplish this is by instructing the liver to release stored glucose into the bloodstream. In short bursts, this response is useful, but when stress becomes chronic, persisting for weeks, months, or years, the constant elevation of cortisol can lead to sustained increases in blood sugar and progressive insulin resistance. It's not uncommon to see patients who appear to be following healthy diets and exercising regularly, yet their HbA1c remains stubbornly elevated. When their lifestyle is explored more deeply, persistent stress often emerges as a significant contributor. Stress management techniques such as mindfulness meditation, breathing exercises, physical activity, time in nature, and social connection can reduce cortisol levels and improve metabolic health. Another strategy that has gained increasing attention is time-restricted eating. Often referred to as intermittent fasting, this approach focuses on limiting the hours during which food is consumed rather than strictly controlling calorie intake. Research suggests that aligning eating patterns with the body's natural circadian rhythms can improve insulin sensitivity and glucose metabolism. In particular, eating earlier in the day and avoiding late-night meals appears to support better blood sugar regulation. Late evening eating tends to produce higher glucose responses because the body's insulin sensitivity naturally declines as night approaches. By finishing meals earlier and allowing a longer overnight fasting period, the body spends more time in a metabolic state that favors fat burning and improved glucose regulation. However, this strategy works best when it fits comfortably within a person's lifestyle. For some individuals, it becomes a helpful structure that naturally reduces overeating. For others, it feels restrictive and difficult to sustain. Flexibility is important. There is one final dietary factor that deserves special attention: ultra-processed foods. Ultra-processed foods dominate modern food environments. These products are often engineered for convenience, long shelf life, and intense flavor, but not necessarily for metabolic health. They frequently contain refined carbohydrates, added sugars, unhealthy fats, and additives that alter texture and taste. Researchers studying eating behavior conducted a fascinating experiment in which participants were offered two types of diets, one composed primarily of whole foods and another consisting largely of ultra-processed foods. Both diets were carefully matched for calories, sugar, fat, and carbohydrates. Participants were allowed to eat as much as they wanted. Despite the similar nutrient profiles, those eating the ultra-processed diet consumed roughly 500 additional calories per day and gained weight over the course of the study. Several mechanisms may explain this effect. Ultra-processed foods are often easier to eat quickly, bypassing many of the body's natural satiety signals. They also tend to contain less fiber and fewer micronutrients that support metabolic regulation. Frequent consumption of these foods has been strongly associated with higher rates of obesity, insulin resistance, and type 2 diabetes. Replacing ultra-processed products with whole foods, vegetables, fruits, legumes, fish, eggs, whole grains, and minimally processed proteins can stabilize blood sugar patterns and naturally reduce calorie intake without strict dieting. For many individuals, this single shift dramatically improves HbA1c over time. Finally, there are situations where lifestyle changes alone may not be enough to fully control blood sugar levels. In those cases, medication can play an important supportive role. One of the most widely used medications is metformin, which improves insulin sensitivity and reduces the liver's production of glucose. It has been studied extensively for decades and remains a foundational therapy for many people with type 2 diabetes. Newer medications have also expanded treatment options. GLP-1 receptor agonists help regulate appetite, slow stomach emptying, and improve insulin secretion. Many studies show substantial reductions in HbA1c along with meaningful weight loss and cardiovascular benefits. Another class of medications known as SGLT2 inhibitors works through a different mechanism. These drugs encourage the kidneys to excrete excess glucose through urine, lowering blood sugar levels while also providing protective effects for the heart and kidneys. Medication should never be viewed as a personal failure. Instead, it is one of many tools available to help restore metabolic balance when needed. When combined with lifestyle improvements, These therapies can significantly reduce the risk of long-term complications. But perhaps the most important concept to understand is that HbA1c does not respond to a single change in isolation. It reflects the cumulative impact of many aspects of your life: your diet, movement patterns, sleep quality, stress levels, body composition, and even the health of your gut microbiome. When several of these factors begin to improve simultaneously, the effects compound. Small consistent changes gradually shift the biological environment within your body toward greater metabolic resilience. And over time, those changes become visible in the numbers. In clinical medicine, the 3-month window reflected by HbA1c becomes a powerful feedback loop. It reveals whether the daily choices you make are quietly moving your health in a better direction or slowly pushing it toward disease. One of the striking observations from years in hospital wards and emergency departments is how rarely serious metabolic complications appear in isolation. Patients who arrive with heart disease often also show early kidney damage. Those with nerve damage frequently have retinal changes affecting vision. These conditions tend to cluster together because they share the same underlying driver: chronic exposure to elevated blood glucose. But what makes this story remarkable is that the earliest stages of the process are often reversible. Prediabetes does not have to progress to diabetes. In many cases, it can be pushed back toward normal metabolic function through sustained lifestyle changes. Even early type 2 diabetes can sometimes enter remission when the body's insulin sensitivity improves and excess visceral fat is reduced. The challenge is timing. When HbA1c begins creeping upward from 5.3 to 5.6, from 5.6 to 5.9, it may not feel urgent. Nothing hurts. Energy levels might seem normal. Life continues as usual. Yet beneath the surface, the metabolic system is being asked to work harder each day. Years later, the consequences appear in forms that feel sudden but are actually the result of long-standing processes. A blocked coronary artery, a stroke that interrupts speech or movement, kidney function that declines until dialysis becomes necessary. By the time those events occur, the body has often been signaling distress for years through rising glucose markers. HbA1c is one of the earliest signals we have. And unlike many risk factors in medicine, it is profoundly influenced by everyday behavior. Choosing whole foods over refined ones, moving your body consistently, building and preserving muscle mass, prioritizing restorative sleep, managing stress before it becomes chronic, limiting alcohol, creating an environment where metabolic health can thrive. None of these actions needs to be perfect. Biology rarely responds to extremes as well as it responds to consistency. Small improvements repeated day after day gradually reshape how the body processes energy, stores fat, and responds to insulin. 3 months later, the blood test begins to reflect those changes. 6 months later, the trend becomes clearer. A number that once seemed destined to rise slowly begins to move in the opposite direction. And what that number ultimately represents is far more than a laboratory value. It represents the possibility of reaching older age with clear vision, healthy nerves, functioning kidneys, and a heart that continues beating strongly. It represents the difference between managing chronic disease and preserving the freedom to live independently. All of that begins with paying attention to a number that too many people overlook. Your HbA1c quietly records the story of your metabolism every single day. The question is whether that story will describe a gradual slide toward disease or a steady movement back toward health.